Are you about to have a total knee replacement? Have you recently had a total knee replacement? Let's talk about infections. And if you stick around to the end, I'm going to tell you how to decrease your risk of getting one. What's up, everyone? Dr. Steve, your favorite physical therapist here. I wanted to go over infections and total knee replacements. Now, this data that I'm going to tell you about is actually from my own 10 years of clinical experience working with knee replacement patients, as well as a study from 2013. They looked at almost 56,000 total knee replacements from the Journal of Bone and Joint Surgery is where some of this data is going to come from. First off, incidence. So infections are rare. They happen between 0.7 and a little over 1% of knee replacements will get an infection. And of those infections, there's actually multiple types. So you could have a superficial infection, right at the surgical site, or you could have a deep infection. Those are the problematic ones that you really want to avoid. Symptoms of a deep infection don't always appear right away. Might not appear for up to 3 months afterwards, sometimes even up to 6 months afterwards. So things that increase your risk of getting an infection after total knee replacement, no surprise here, having a BMI greater than 35, being a diabetic, having an operation time of longer than 210 minutes, and also having what's called an ASA score of 3 or greater. Now we'll talk about that more in the future. So ideally you get your ASA score to be 1 or 2 because that was found to be protective of an infection. So things that protect you are, again, an ASA score of 1 or 2, having a shorter surgical time, so a surgical time of less than 120 minutes compared to a longer operational time of 210 minutes. That puts you at a greater risk. And also, it's kind of funny to see this, but getting both knees done at the same time, so having a bilateral total knee replacement, decreases your risk of having an infection. My own personal commentary there is that people that get both knee replacements done at the same time tend to be healthier patients, tend to be healthier people. Most doctors wouldn't subject you to that unless you're a fairly healthy person with not many other comorbidities except for your arthritic knees. Well, how do you lower your risk of an infection? And I believe it all lies in this ASA score. So the ASA score stands for the American Academy of Anesthesiologists. Essentially, you're doing the simple things to improve your health, either right before the surgery and immediately after. Things like controlling your diabetes. So if you're diabetic or even pre-diabetic, I would be checking my blood sugar levels. Now this is a bit of a warning shot to people with pre-diabetes, because you might not be used to checking your blood sugar levels. You might only be on oral hypoglycemic and you're not checking it. After that surgery, you're going to be in a stressful state. You're not going to be sleeping. You're not going to be feeling as well. That could trigger you into a moment of being diabetic. So even people with pre-diabetes, I would always recommend be checking your blood sugar. So without good blood and a good blood sugar range, you are likely not going to be healing as you should and being able to fight off infections. Managing your high blood pressure, try to eliminate smoking as much as you can, doing the best that you could to lose some weight going up to your surgery. Now I get it, you have an injured leg, so exercise is going to be difficult if not impossible going into the surgery. So doing things like trying to manage that dietarily to lose a little bit of weight and lower your BMI. So those are all things that you can be aware of. Try to improve your outcomes and decrease that chance of an infection. Now again, this is a rare thing. It doesn't happen very often, but when it does happen, it's not a fun process if you have to, ultimately the worst case scenario is they go and have to actually do a full revision, a 2-step revision. They take the hardware out, put a spacer in. You're not allowed to put weight on that leg for a couple weeks while the infection clears out. Have to redo the knee replacement. So these are not fun things, guys. I would absolutely be doing whatever I can to lower my risk of an infection. So this video isn't meant to scare you, just educate you. Again, any questions, comments below, give it a like, give us a follow. It's going to help us grow this channel even more. Thanks a lot, and we'll see you on the next video.